Have you ever wondered what actually causes a person with cancer to die? Is it the tumor itself? Is it unbearable pain? Or is there something happening inside the body that most people never fully understand? The answer may surprise you. Millions of people around the world hear the word cancer every year, yet very few truly know what happens during the final stages of this disease. Understanding this process is not about creating fear. It's about replacing myths with facts and helping families, caregivers, and patients better understand one of the most important medical realities of our time. In today's discussion, we're going to uncover what really happens when cancer progresses, how it affects the body's most vital organs, why some patients become increasingly weak, and what medical professionals observe during the final phase of life. We'll also discuss the warning signs that often appear, the role of pain management, and the truth about what patients commonly experience during their last days. By the end of this speech, you'll have a clearer understanding of a topic that is often misunderstood, rarely discussed openly, and incredibly important for anyone touched by cancer. So stay with me until the end, because the final keynote may completely change the way you think about end-of-life care and the support that families can provide during one of life's most challenging moments. Many people assume that cancer directly kills a person simply because a tumor grows somewhere in the body. However, the reality is often much more complex. In many cases, it is not the original cancer itself that causes death, but the damage it creates throughout the body over time. Cancer begins when abnormal cells grow uncontrollably and ignore the normal signals that tell healthy cells when to stop dividing. As these cancer cells multiply, they can invade nearby tissues and eventually spread to distant organs through the bloodstream or lymphatic system. This process, known as metastasis, is responsible for the majority of cancer-related deaths. When cancer reaches critical organs such as the lungs, liver, brain, or bones, it can interfere with their ability to function properly. For example, if cancer spreads extensively to the lungs, breathing may become increasingly difficult because the body can no longer get enough oxygen. If the liver becomes overwhelmed with cancer, it may lose its ability to remove toxins from the blood and process essential nutrients. Cancer in the brain can affect consciousness, movement, and vital body functions. In many advanced cases, multiple organs are affected at the same time, creating a situation where the body gradually loses its ability to maintain normal life-sustaining processes. Another major factor is the severe physical weakness that often develops in advanced cancer. The disease can dramatically increase the body's energy demands, while reducing appetite and the ability to absorb nutrients. As a result, patients may experience significant weight loss and muscle wasting, a condition known as cancer cachexia. This loss of strength makes it harder for the body to fight infections, recover from illness, or tolerate treatments. Over time, the combined effects of organ dysfunction, weakened immunity, malnutrition, and widespread disease place enormous stress on the body, leading to a gradual decline in overall health and function. One of the most dangerous aspects of cancer is its ability to spread beyond the place where it first began. A cancer that starts in the breast, lung, colon, or another organ may remain localized for some time, but as the disease progresses, cancer cells can break away from the original tumor and travel throughout the body. These cells move through the bloodstream or the lymphatic system, eventually settling in new locations where they begin forming additional tumors. This process is called metastasis, and it is responsible for most cancer-related deaths worldwide. The reason metastasis is so serious is that it allows cancer to attack multiple organs at the same time. Each organ in the body performs essential functions that keep us alive. When cancer spreads to these organs, their ability to do their jobs becomes increasingly limited. For example, when cancer reaches the lungs, it can reduce the amount of oxygen entering the bloodstream, making breathing difficult and leaving the body deprived of the oxygen needed for survival. If cancer spreads to the liver may struggle to filter toxins, regulate nutrients, and support digestion. When cancer reaches the brain, it can affect memory, speech, movement, personality, and even the body's automatic functions that control breathing and heart activity. Cancer that spreads to the bones can cause severe pain and increase the risk of fractures, making even simple movements difficult. In some cases, the bone marrow may also be affected, reducing the body's ability to produce healthy blood cells. As more organs become involved, the body faces multiple challenges simultaneously. Vital systems begin working less efficiently, energy levels decline, and complications become more frequent. The combined effect of widespread cancer throughout the body places enormous strain on every main organ system, gradually reducing the body's ability to maintain normal function and sustain life. As cancer reaches its advanced stages, the body often begins to show a series of warning signs that indicate it is struggling to cope with the disease. These changes can develop gradually over weeks or months, although in some cases they may appear more rapidly. Understanding these signs can help families and caregivers recognize what is happening and provide appropriate support during a very challenging time. While every person's experience is unique, there are several common changes that medical professionals frequently observe in patients with advanced cancer. One of the earliest and most noticeable signs is extreme fatigue. This is far more than ordinary tiredness. Many patients describe feeling exhausted even after resting or sleeping for long periods. Simple activities such as walking, eating, or having a conversation may require significant effort. Along with this fatigue, appetite often decreases dramatically. Patients may lose interest in food and drink, not because they are choosing to eat less, but because the body's needs and metabolism are changing as the disease progresses. Weight loss and muscle wasting may also become increasingly apparent. As the body loses strength, mobility becomes more difficult. Some patients spend more time sitting or lying down and may eventually need assistance with daily activities. Changes in sleep patterns are also common, with individuals sleeping for longer periods and becoming less interested in social interaction or their surroundings. Mental and emotional changes can occur as well. Some patients experience confusion, forgetfulness, or difficulty concentrating, especially if the cancer affects the brain or if organ function begins to decline. Breathing patterns may change, becoming slower, faster, or more irregular than usual. In certain cases, swelling in the legs, hands, or abdomen may develop due to fluid retention or reduced organ function. These warning signs often reflect the body's gradual response to advanced illness and indicate that important physical systems are under increasing stress as cancer continues to progress. One of the most significant reasons advanced cancer becomes life-threatening is its impact on the body's immune system and energy reserves. The human body depends on a delicate balance of nutrients, oxygen, and immune defenses to maintain health and repair damage. Cancer disrupts this balance in multiple ways. As cancer cells grow and multiply, they consume large amounts of energy and nutrients that would normally support healthy tissues. Unlike normal cells, cancer cells continue growing without regard for the body's needs, creating a constant drain on physical resources. At the same time, the immune system is forced into an ongoing battle against the disease. Although the immune system is designed to identify and destroy abnormal cells, many cancers develop ways to hide from immune defenses or weaken the body's natural response. As the disease advances, the immune system may become overwhelmed, making it harder to fight infections and other illnesses. This is one reason why even relatively minor infections can become serious complications for patients with advanced cancer. Another major issue is a condition known as cancer cachexia, a complex syndrome involving severe weight loss, muscle wasting, and weakness. Unlike ordinary weight loss caused by dieting or reduced food intake, cachexia results from changes in the body's metabolism. Even when patients try to eat, the body may struggle to use nutrients effectively. Muscle tissue is gradually broken down, leading to a loss of strength and physical function. Many patients find it increasingly difficult to walk, climb stairs, or perform routine daily activities. As muscle mass declines, important organs can also be affected. The heart, respiratory muscles, and other essential structures may become weaker over time. Reduced nutrition and declining physical reserves leave the body with less ability to recover from stress, illness, or medical treatments. Eventually, the combination of weakened immunity, severe muscle loss, reduced energy production, and ongoing cancer growth places extraordinary strain on the entire body, contributing to a progressive decline in overall health and physical resilience. Many people fear that the final days of cancer are always filled with constant suffering, but the reality is often more complex and, in many cases, far different from what people imagine. Modern palliative care and pain management have greatly improved the ability of healthcare professionals to help patients remain as comfortable as possible. While symptoms vary depending on the type of cancer, the organs involved, and the individual's overall health, there are several experiences that are commonly reported during the final stage of advanced cancer. One of the most noticeable changes is a growing need for rest. Patients often spend more time sleeping and may have less energy for conversation or daily activities. This is a natural response as the body conserves its remaining energy. Many individuals gradually become less interested in eating and drinking. Family members sometimes worry that their loved one is starving, but in reality, the body's need for food often decreases significantly during this stage. Forcing food or fluids may not improve strength and can sometimes create additional discomfort. Pain is another concern that many people have. Although some cancers can cause significant pain, modern medications and supportive treatments are often effective at reducing discomfort. Healthcare teams carefully adjust treatments to help control symptoms while maintaining as much comfort as possible. Shortness of breath may also occur, particularly if cancer affects the lungs or other vital organs. But medications and supportive care can often help ease this sensation. As the body continues to slow down, mental changes may occur. Some patients become less responsive, sleep more deeply, or experience periods of confusion. Others may appear calm and peaceful, spending less time focused on the outside world. Changes in breathing patterns, circulation, and body temperature are also common as the body's systems gradually begin to shut down. While each person's journey is unique, many healthcare professionals and caregivers observe that patients often become increasingly quiet and less aware of physical discomfort as the final stage progresses, with comfort and dignity remaining the primary goals of care. For families, watching a loved one go through the final stages of cancer can be one of the most emotionally difficult experiences of life. Feelings of fear, sadness, helplessness, and uncertainty are completely normal. However, understanding what is happening and knowing how to provide support can make a meaningful difference for both the patient and their loved ones. End-of-life care is not about giving up hope. It is about focusing on comfort, dignity, compassion, and quality of life when a cure is no longer possible. One of the most important things families can do is simply be present. Patients often value companionship, reassurance, and emotional connection more than anything else. Even when a person becomes less responsive, many healthcare professionals believe that hearing may remain one of the last senses to fade. Gentle conversations, comforting words, holding a hand, or simply sitting quietly nearby can provide tremendous emotional support. These small acts of kindness often bring comfort to both the patient and family members. It is also important for families to understand that changes in eating, drinking, sleeping, and communication are often natural parts of the dying process. These changes do not necessarily mean that a loved one is suffering. In many cases, the body is gradually slowing down and requiring less energy. Understanding this can help reduce unnecessary anxiety and prevent feelings of guilt when a patient no longer wishes to eat or participate in activities. Working closely with doctors, nurses, and palliative care specialists is another essential part of end-of-life care. These professionals can help manage pain, breathing difficulties, anxiety, and other symptoms while providing guidance to family members. They can also answer questions and help loved ones prepare for the changes that may occur. Above all, families should remember that the goal during this stage is not simply to extend life, at any cost, but to ensure that the patient experiences as much comfort, peace, dignity, and emotional support as possible throughout their final journey. As we come to the end of this discussion, one truth becomes clear. Cancer does not usually take a life in a single moment. It is a gradual process that affects the body's organs, energy, immune system, and ability to function. Understanding how a person dies from cancer is not about focusing on death. It is about understanding life, compassion, and the incredible resilience of the human body. Many people fear cancer because they do not understand what happens during its final stages. But knowledge replaces fear with awareness. When we understand the warning signs, the physical changes, and the challenges patients face, we become better equipped to support those who are living with this disease. We learn that comfort, dignity, and emotional connection are just as important as medical treatment. For families and caregivers, the greatest gift is often not finding the perfect words or solutions. It is being present, offering love, listening without judgment, and helping a loved one feel valued and respected until the very end. Even during the most difficult moments, human connection remains powerful. Cancer may weaken the body, but it does not erase a person's worth, memories, or the impact they have had on others. Every patient has a story, a family, and a life that deserves compassion and respect. By understanding the realities of cancer, we can face this challenging subject with greater empathy and less fear. Thank you for watching. If you found this information valuable, share it with someone who may benefit from a better understanding of cancer and its final stages. Awareness can help families prepare, make informed decisions, and provide the support that matters most when it is needed the most.